After several years of commitment, hard work, and meritorious service in the public health space, home and abroad, Dr. Chukwuma Anyaike retired in December 2024 as a Director of Public Health at the Federal Ministry of Health and Social Welfare, a position he assumed on the 1st of August 2023. For friends, colleagues, and close associates of Dr. Chukwuma Anyaike, it was a very emotional moment as they took turns to recount his impact.
Dr. Anyaike is more than a professional colleague. He is a friend and a brother. And not only at personal level, but also to everyone in KNCV. We will miss Dr. Anyaike. He is retired and he is not tired. And I'm very, very sure that we will continue to work with him. He will remain a resource, not only to the ministry, but to we the partners. But coming down to KNCV, Anyaike has really been very, very supportive. I know a lot we've been able to do working with the National TB program when he was there as the national coordinator.
Dear Director among directors, multiple award winner, vision, drive, and charisma personified. It is a great privilege to say a hearty congratulations to you on reaching this ultimate milestone. You came, you saw, and you conquered. Your tenacity, your dedication, your determination, and resilience inspires passion in all of us. You exemplify the very essence of public health, and in fact, your transformational leadership has changed the public health space in Nigeria for the better. It has set it on a successful path for years to come. We will miss your presence, but your influence is forever with us.
Our boss, our mentor, our chief, and indeed a father to many of us in the TB program, Dr. Chukwuma Anyaike, the Director, Public Health, Federal Ministry of Health, Nigeria, on the occasion of your retirement from civil service. As the Director and National Coordinator of the National TB and Leprosy Control Program, Dr. Anyaike helped to put Nigeria in an enviable position with the increasing trend in TB case finding, which we have seen in the last 4 years. Also, as the Director, Public Health, Federal Ministry of Health, we have all seen the remarkable strides we have made, especially as relates to the sector-wide approach in the Federal Ministry of Health. As you go to this new level, sir, my prayer for you is that you enjoy your retirement in good health, in prosperity, and that you will reap the rewards of your labor to the civil service in Nigeria.
A good boss is very difficult to come by, and I'm sure we are going to miss you a lot. I may not have worked directly under you. However, there are little things you do that inspire me a lot. You call all of us by our names. It is a sign of humility, and I do not take that for granted. As you retire, I want to wish you joy, fulfillment of all your dreams. And once more, I want to say congratulations on a successful career.
Wishing you a retirement without illness, stronger health, and to also appreciate you for all the innovative ideas you've brought into the public health system and all your contribution, ensuring that implementing partners have a good environment to work. And also to let you know that you're a nice person. Meeting you was a very good one for me.
Immediately I started working with him, I started gaining new knowledge about life's perspective. And that was where the mentoring began for me. And he encouraged me to proceed for further studies, which I took very seriously. I went for my master's. He still encouraged me in my work and further encouraged me to go for further studies. I told him I wanted to take a PhD. He gave me a thumbs up to move ahead with it. All through my program in faraway Australia, Dr. Anyaike continued the mentoring. It didn't stop there. Like, he was studying with me, and he gave me all the support.
Dr. Anyaike is a man preceded by his reputation, and everybody around here knows who he is. The evidence of what he has achieved in the Federal Ministry of Health is there for everybody to see.
My first encounter with you was when we both traveled to Gabon. And I think that actually changed my perspective about Dr. Anyaike. He's my boss. He's my friend. He's my confidant. He's a wonderful man to me. He's intelligent, straight to the point.
Dr. Anyaike is somebody that I can refer to as a seasoned and a refined administrator. Very resourceful, very amiable, and highly principled.
He was able to exceed the targets for hepatitis. I know he also did similar feats with the National Tuberculosis and Leprosy Control Program, as well as other places where he worked. So for me, he's been an inspiration, one of those that I have looked up to as people that I needed to pattern my life like after regarding professionalism. The health system in Nigeria has certainly benefited from his expertise, and I commend him for that. He loves to study, loves to know things, loves information, loves being on top of his game.
When I look at him, I see a man who wanted the best, not only for the Federal Ministry of Health or for the country, or even for the staff that he has worked with.
One thing I know about him during our work with him was that he was somebody who was genuinely interested in ensuring, wanting to make sure that system works. He really wanted to strengthen the health systems of the work we do, particularly in NDDs. And one of the things I can also say about him is that he was able to bring some level of attention to NDDs. Even though, of course, we call NDDs neglected, but he ensured that when it comes to public health, that it wasn't neglected. So some of the level of attention we have now and the funding we have now, I think I can say it was due to his work.
We're hoping that you would be coming back probably very soon as a consultant, maybe from the political arena, to also work with us. Thank you, sir, for that good job.
And one of the things that I really like about you is your charisma, your strategic leadership, your ability to see beyond sentiments and focus on the big picture, which has always been Nigeria. Thank you for your selfless service to the NTD community, for providing us guidance as partners. And definitely, you will always be remembered for your forthrightness.
As a journalist, I describe his impact in the public health space as second to none, especially his commitment to ending neglected tropical diseases. His belief and passion for communication as a tool to reach the unreached brought him to my notice.
If you come into Lagos, you could see that the slums, the good environment is very dirty and thereabouts. Even in Abuja, I have it at the slums. Then when you go to the rural areas, they're very much, especially the hard to reach parts of the country. They are there.
Why are some of the diseases neglected?
Because it does not kill instantly. Do you understand me? Assuming it's like the Ebola or the COVID-19 that then it will trigger. But this one, it runs a very, long course that leaves people with disability. Someone that fends for the family, a man that goes out and fends for the family, suddenly cannot do that. It has a lot of ripple effect. You won't be able to do the normal work you do. You will take care of your wives, your children, your neighbors, and thereabouts. And so that's why he said keep people in the trap of poverty. Today is specifically marked for awareness creation and then for resource mobilization, focused advocacy to the philanthropists, to the government, and to other major stakeholders, partners, to also remember there's need for resource mobilization to tackle the menace of neglected tropical diseases.
A detribalized Nigerian who hails from Abia State, Dr. Anyaike started his civil service career as a medical officer in January 1996 at the Federal Staff Hospital, 1004 Victoria Island, Lagos State, Southwest Nigeria. He has special interest and skills in policy development, provision of effective and efficient healthcare delivery systems, as well as control of infectious diseases. As a manager of human resources, Dr. Anyaike successfully developed and managed several national programs to maturity, including the prevention of mother-to-child transmission of HIV, syphilis, and viral hepatitis among key populations in Nigeria through creative partnerships and collaborations with international, national, and local organizations.
I'm following his footsteps because he has gone around many departments, programs, and projects in the ministry. He's been in the hospital services. He's headed an hospital before. He has been in the HIV program. He has been neglected tropical disease. He has been in malaria program, TB programs, and now as the head of Department of Public Health. So you agree with me that he has traversed the length and breadth of public health.
He's actually somebody that don't care where you come from. All he wants is he wants to know about your ability. And I have seen this in him by his ability to try to coalesce people of the like mind and put them into an activities so that they usually get results. And to me, it's actually what the system need. The system need people that can harness the like mind, put them into an activities so that they come out with results and not people of different mind that you put together and it's all argument and nothing comes out of it.
Dr. Anyaike is a very brilliant man, very dedicated to service. He carries his team along, especially his team members that are ready to work. If you are ready to work, you are his friend. I will categorize him as one of the bosses that if you have him as your immediate boss, he's good for you because you learn from him. He will not victimize you. Rather, he will advise you and will tell you how to forgive others. Even though he will teach you the way to really tackle difficult issues. Nobody is perfect, but what he has done, man, I'm telling you, is worth remembering forever.
Yes, life is in stages, it's in phases. You've just stepped into a new phase. And, we are so grateful that you are doing that in good health. Your legacy in the public health space is there for everyone to see. You've been a trailblazer, you've been a bulldozer, a goal-getter, yes, and a champion. God, who has kept you thus far, will continue to keep you, that He will open new doors for you, doors that you've not even imagined. And I will urge you to take that well-deserved rest, enjoy your family, enjoy golf, and I'm sure one of these days I'll come and beat you to your game. I love you as a brother. God bless you.
The shining light of Dr. Chukwuma Anyaike was evident right from childhood and early school days when he emerged one of the best 3 students that were selected from the then Isikwato Okigwe local government area in the former Imo State to attend the prestigious government college, Umuahia, where he became the school chapel captain. After his first degree at the University of Nigeria, Nsukka, where he studied medicine and surgery, Dr. Chukwuma obtained a master's degree in community medicine from the University of Ilorin, Kwara State, in 2004. He proceeded to the London School of Hygiene and Tropical Medicine for a postgraduate diploma in tropical medicine and hygiene. In 2008, Dr. Anyaike commenced his residency program in public health and 3 years after, qualified as a consultant public health physician at the West African Postgraduate Medical College. His educational qualification could go on and on, with several years of work experience that has earned him national and global recognitions. Blessed with a beautiful wife and children, Dr. Chukwuma Anyaike can best be described as a man whose footprints in the public health space will never be forgotten. For your events coverage, advertisement of goods and services, Dara Network TV is a veritable platform for you. Try us today.